Chairperson, Governor's Wives Forum, and wife of Governor of the State, Her Excellency, Dptc Climate, Your Excellencies, Governor's Wives, other major stakeholders, the Country Director, Unodc, Mr. Oliver Stolten, and other senior officials of the Unodc, Secretary, NDIDA, directors, gentlemen of the press, ladies and gentlemen. It is with immense pleasure that I welcome Your Excellencies and other delegates to this two-day workshop on drug prevention, treatment and care, Dptc. There have been a series of Dptc training, but this one is historic as an indication of the resolution by the Nigeria Governor's Wives Forum to play a key role in the country's renewed war against drugs. As we are all aware, the drug problem has become one of the world's greatest challenges that threaten the well-being of human society. Consequences of drug use, including chronic health conditions and untimely death, are existential threats that cannot be ignored by any responsible government. Just last year, the World Drug Report 2021 warned of a likely 11% increase in the number of people who abuse illicit substances over the next decade. About 40% of that increase is projected to come from Africa alone. And when they say Africa, we should think Nigeria, the most populous country on the continent. But I'm confident that with the interest shown by Your Excellencies and First Ladies from our states, that 40% will be unachievable. We are definitely going to drive it down significantly by the grace of God. These are the basis for our renewed effort to muzzle the illicit drug problem quickly and preempt what could, in the nearest future, become a full-blown epidemic and a new problem area for the continent and our country. The drug prevention, treatment and care training is designed to enhance the capacities of Your Excellencies and other stakeholders to implement evidence-based drug prevention education programs, as well as enhance accessibility of treatment and care for those with substance use disorder, and also facilitate their social reintegration where and when necessary. At the conclusion of the workshop, we expect that participants will have a better understanding of the dynamics of the illicit substance conundrum and therefore be in a vantage position to protect our society from its corrosive impact. As a critical stakeholder group, the training will put you in the driving seat to effect far-reaching changes in the effort to protect members of society who are most susceptible to the use and abuse of illicit drugs. The position occupied by Your Excellencies affords you the leverage to make a difference in communities in your various states. We thank you all very much for being part of this forum. Your presence here shows your willingness, Your Excellencies, to contribute to the health and welfare of humanity. We look forward to a fruitful workshop and effective results thereafter. Thank you very much for this time.
As you will recall, the World Drug Day is commemorated every year on 26th of June. And this year's World Drug Day theme focuses on addressing drug challenges in health and humanitarian crisis. A theme which is befitting to the Nigerian situation where not long ago thousands of drug users were prevented from accessing treatment and counseling due to COVID-related restrictions, and at the same time, the persisting humanitarian crisis which affects millions, in particular in the north of the country, creates specific vulnerabilities also when it comes to drug use. Excellencies, based on the 2017-2018 data, we estimate that today close to 6 million persons in Nigeria would be living with a drug use dependency. That's almost double than what we measured in 2018. This creates a massive public health challenge. Our key policies asks on this World Drug Day to the federal government, state governors, to the international development partners, and last but not least, yourselves, Your Excellencies, is not to lose sight of the public health crisis caused by drug use. More specifically, we need your help to train teachers across approximately 27,000 public and private secondary schools in the country. Children need to be exposed to drug prevention programs. They need to have the necessary life skills in order to deal with the challenges posed by the availability and the use of drugs around them. And we need to provide access to quality drug treatment for millions of persons, in particular, again, women and girls. All states should set up and institutionalize state-controlled drug control committees and provide them, very importantly, with the necessary budgetary allocation to enable them to achieve and help achieving these specific objectives I just outlined. Your role as advocates and educators cannot be overemphasized, and most hopefully, of course, as the chairs of these drug control committees. Now, we look very much forward to discussing with you over the next 2 days these and other measures that you would like to discuss to strengthen drug prevention, treatment, and care in your respective states, as well as to learn from each other what might already have worked and what has shown promise. I thank you very much, and I'm looking forward to being with you.
This event is a part of a series of important events taking place in Abuja this week, and evidence of this soft approach. Many of you have assisted in the events this week, as well as in the celebration of the International Day Against Drug Abuse and Illicit Trafficking. Congratulations to all partners for this important achievement. Since this sensitization training is going to look at important achievements and deliverables and our support, I would like to take a look back and look at what has been achieved and congratulate our long-standing partners, and especially NDIA, for the validation of the National Drug Control Master Plan 2021-2025, a policy document that illustrates well the excellent collaboration between the European Union, NDIA, and Unodc towards the new National Drug Control Master Plan, which also confirms the engagement that the European Union has undertaken in the framework of its external action. Today's event marked the potential that state governments have in shaping and influencing national policies and positively impacting on society. Through our support, the WISE Governance Forum can further increase awareness on drug prevention, treatment and care, further reduce stigma on drugs, as well as pave the way for more initiatives in the field of drug demand reduction. I would like to thank Unodc for the overall implementation of the project. I would also like to thank all our partners for the resilience that they have shown in the past few years, with special mention to civil society organizations across the country, as well as law enforcement officials for their important interventions during 2 years of very difficult movements. Last but not least, I would like to thank the WISE Governance Forum, all the First Ladies and their representatives for their request and willingness to be involved in the area of drug prevention and their initiative to gather under one roof. Thank you for your attention, and I wish you a very fruitful training and exchange of views.
I wish to thank the NDLEA and the Chairman, General Buba Marwa, for their kind invitation to this event today. I'm glad to be here at this capacity building program on drug prevention, treatment and care for the governor's wives and other stakeholders, which commences today, the 28th of June 2022. It is timely and it will enhance the skills of stakeholders to implement relevant programs to address drug challenges in health and humanitarian crisis. This is in line with this year's World Drug Day theme. Permit me to therefore commend the National Drug Law Enforcement Agency, NDLEA, and the United Nations Office on Drugs and Crime, UNODC, for organizing this forum. The drug problem and its associated consequences remains complicated, and it will require appropriate skills, concerted efforts to deal with the drug menace at all levels. We need to consistently tackle issues of hectares of farmlands being used for cannabis production. As a country, we will continue to pay attention to measures of reducing the illicit drug trade and the demand for substances for abuse purposes. The experiences and learnings from this forum, I understand, will help stakeholders implement evidence-based prevention and sensitization programs to different target groups across communities. I commend the European Union for funding the response to drugs and related organized crime project in Nigeria. And I thank UNODC for implementing the project, especially building this brief to clap for them. Thank you, UNODC, especially for building the capacity of our stakeholders in addressing the challenges of substance abuse across communities. Thank you all for all your efforts, and I wish you a fruitful program. Thank you for listening.
It gives me great pleasure to be here today at this very important event. And on behalf of the Nigerian Governors Vice Forum, I'd like to say a very big thank you to NDLEA, UNODC, and the European Union for making this happen. Recently, a delegation from the Nigerian Governors Vice Forum met with the NDLEA chairman to inform him that we have decided to adopt drug abuse prevention as another flagship program of our forum. Our members have worked with NDLEA in the past, with particular reference to the Northern Governors Vice Forum, who have participated in NDLEA activities and have also served on committees. The Southern Governors Vice Forum also recently decided to focus on drug abuse as a matter of utmost concern. As a result, the entire body of Governors Wives is committed to addressing this serious issue. We know there is a strong link between drug abuse and sexual and gender-based violence. We therefore pledge our support for NDLEA to ensure that our country and communities become drug-free. We are not willing to stand by as mothers and see our children fall into the bottomless pit that drug abuse represents. We thank NDLEA for agreeing to work with us as important allies in furtherance of the objectives of the agency. We also appreciate the partnership of the NDLEA that enables state first ladies function as champions for the agency in their respective states. We promise to follow up on the issue that has been raised by the NDLEA chairman that state first ladies should chair the state drug control committees. Thank you for this, sir, and thank you for taking us off the black market. Together, we will be able to celebrate our children and their children and not mourn their loss to this dangerous menace. Thank you, and I wish us all fruitful deliberations.
you.